Hello, pharma aspirants. Welcome to Pharma Syndrome YouTube channel. So, if you are preparing for pharma government exams like drug inspector, pharmacist, like all types like ESIC, railway pharmacist, there are different types of pharmacist are there. And even if you are preparing for GPAT as well as NIPER, so subscribe to our channel. And in this session, I am discussing MCQs with explanation on the general anesthetics. So, first question is general anesthetics depress which of the following system? And the correct answer here is reticular activating system, that is RAS. RAAS means renin angiotensin aldosterone system at the kidney, and this is a RAS, that is reticular activating system. So this is a reticular activating system is a conscious center of our brain. That's why these drugs depress that conscious center and make the CNS in the relaxation condition. So all general anesthetics mechanism is generally they deactivate the reticular activating system of the brain, that is conscious center. And pyramidal system, there is a pyramidal and extrapyramidal system in the brain regarding anatomy. And nigrostriatal system means in the nigrostriatum there is a involvement of dopamine, especially imbalance between dopamine and acetylcholine in the nigrostriatal pathway develops into the movement disorders, that is Parkinsonism. So regarding here, general anesthetics may block the NMDA receptor, may agonize the GABA A receptor. There are different mechanisms is there, but generally the general anesthetic depress the conscious center of the reticular activating system, that is in the brain. Next, question number 2 is which of the following general anesthetic is a NMDA receptor agonist? So NMDA, N-methyl D-aspartate, it is a ionotropic or ion channel receptor, and here the drug is ketamine. So ketamine is a NMDA receptor antagonist. So NMDA is a ionotropic or ion channel receptor. Here ketamine is blocking the NMDA receptors. And nitric oxide is a nitrous oxide is a, it is also general anesthetic, but it not mechanism is a NMDA blocking. And thiopental sodium, generally it is a GABA A receptor agonist. And ether also not a NMDA receptor blocker. And ketamine also known as dissociative anesthetic. Ketamine is also known as dissociative anesthetic. So why it is called as, because of ketamine is called as dissociative anesthetic because it will dissociate person from the surroundings. So generally all general anesthetic relax the central nervous system. In that condition the patient in the unconscious nature generally, but this drug making the person into hallucination and it dissociating person from the surroundings. Generally, no general anesthetic does not produce hallucinations, false perception, but ketamine produces. That's why it is called dissociative anesthetic. Dissociate patient from the surroundings. And అంటే జనరల్ గా కీటమైన్ అనే డ్రగ్ జనరల్ అనెస్టిక్ కాబట్టి సిఎన్ఎస్ మీద రిలాక్సేషన్ ప్రొడ్యూస్ చేసి అన్కాన్షియస్నెస్ లోకి వెళ్ళిపోవాలి పర్సన్. కానీ ఇక్కడ ఏమవుతుందంటే కనుక ఇది హాలిజినేషన్స్ ప్రొడ్యూస్ చేస్తుంది. హాలిజినేషన్స్ అయితే ఫాల్స్ పర్సెప్షన్స్, అంటే పేషెంట్ ఎలా ఫీల్ అవుతాడంటే అతనికి ఏదో జరుగుతున్నట్టు, అతని మీద ఏదో పాకుతున్నట్టు ఫీల్ అవుతూ ఉంటాడు అనమాట. కానీ జనరల్ అనెస్టిక్స్ అనేవి అసలు అన్కాన్షియస్నెస్ కాజ్ చేస్తాయి, ఎటువంటిది కూడా అతనికి తెలియదు. బట్ ఇవి జనరల్ అనెస్టిక్ గా పనిచేస్తుంది కీటమైన్, కానీ కూడా ఇది హాలిజినేషన్స్ ప్రొడ్యూస్ చేయడం వల్ల దీన్ని ఏమంటారంటే కనుక డిసోసియేటివ్ అనెస్టిక్ అంటారు. సో దట్ ఈస్ ద సెకండ్ క్వశ్చన్. అండ్ నెక్స్ట్ గోయింగ్ టు ద థర్డ్ క్వశ్చన్, వాట్ ఈస్ ద రోల్ ఆఫ్ barbiturates as a pre-anesthetic? So regarding general anesthesia, before entering into the full-fledged surgery, we have to give some pre-anesthetic agents. So in that pre-anesthetic agent, number of things are there, like skeletal muscle relaxant to relax skeletal muscle, antiemetics to prevent vomiting, anti-secretory agents to prevent gastric, bronchial, salivary secretions. Like that, number of pre-anesthetic are there. And here, what is the role of barbiturates as a pre-anesthetic agent? What is the role of barbiturate as a pre-anesthetic agent? it produce the sleep. అంటే జనరల్ గా before patient enter into the surgical procedure, he have to administrate with some pre-anesthetic agent. For example, barbiturates to produce sleep, and to reduce anxiety, anxiolytic drugs like midazolam, nothing but benzodiazepine category drugs, and reduces secretions like gastric secretions, antihistamines, salivary secretions also antihistamines, bronchial secretions also like muscarinic receptor antagonist, and regulation of respiration. So generally, barbiturate is not for regulation of respiration. So the role of barbiturate as a pre-anesthetic. Pre-anesthetic means before giving the anesthesia, before giving the సర్జికల్ ప్రొసీజర్. అంటే సర్జరీకి వెళ్లే ముందు లోపు పేషెంట్ ని మనం ప్రిపేర్ చేయాలి. అతను పూర్తిగా సర్జరీకి రెడీ చేయాలంటే అతను పూర్తిగా అన్కాన్షియస్ లోకి వెళ్ళిపోవాలి. అప్పుడు మాత్రమే సర్జరీని మనం క్యారీ అవుట్ చేయగలం. నెక్స్ట్, induction of anesthesia is belongs to. Induction of anesthesia is belongs to. So in surgical anesthesia, there are 4 different stages are there. Stage 1, stage 2, stage 3, stage 4. Stage 1, induction of anesthesia. అంటే మనిషికి మనం anesthesia ఇస్తున్నాము. స్లోగా అతను unconscious లోకి వెళ్ళిపోతున్నాడు. Stage 2, excitement stage. In this stage, there is a chance of excitement. That's why immediately we have to suppress sympathetic system in the body. And the stage 3 is a surgical procedure where we will carry out the surgery. అంటే సర్జరీ 3, స్టేజ్ 3 లో సర్జికల్ ప్రొసీజర్ ని ముందుకు తీసుకెళ్తారు. స్టేజ్ 4 is the last stage where it is called as toxic stage. Generally, the patient should not enter into the stage 4. If he entering into the stage 4 means that is toxic stage. That is the toxic stage. So that is the indication overdose of the drug. That's why in the ICU room, in the surgery time, 24 hours, each second monitoring is essential regarding the respiration, regarding the cardiovascular system, regarding the everything of the patient. So here, the induction is belongs to the stage 1, that is starting of anesthesia. And slowly here, the patient starting into the sedation mode. And next, the next MCQ is that is fifth one. Stage 2 of general anesthesia is also known as. Stage 2 of general anesthesia is also known as delirium stage, also called as excitement stage. So generally, slowly patient from the stage 1 of anesthesia to stage 2 entering, the body will oppose, the body will combat, and the sympathetic nervous system may become overactive. That's why it is called excitement or delirium stage. And this stage is very dangerous. That's why the patient should spend less time in the stage 2 and readily enter into the stage 3, where in the stage 3 the surgical procedure will be carried out. So general గా స్టేజ్ 2 లో ఏమవుతుందంటే గనక పేషెంట్ ఎగ్జైట్ అయ్యే ఛాన్స్ ఉంది. సింపాథిక్ నర్వస్ సిస్టమ్ యాక్షన్ ఎక్కువ అయ్యి రెస్పిరేషన్ ఎక్కువ అవటం కానీ లేకపోతే హార్ట్ రేట్ ఎక్కువ అవటం కానీ జరుగుతుంది. అందుకని సింపాథిక్ నర్వస్ సిస్టమ్ ని కంట్రోల్ చేయాలి, ఎగ్జైట్మెంట్ తగ్గించాలి. కాబట్టి స్టేజ్ 2 నుంచి స్టేజ్ 3కి తొందరగా తీసుకెళ్లాలంటే మనము ఇవ్వాల్సిన డ్రగ్స్ తొందరగా ఇస్తూ ఉండాలి. ఆ డోస్ అనేది అతనికి ఎక్కాలి. సర్జికల్ స్టేజ్ అనేది స్టేజ్ 3 కిందకు వస్తుంది. టాక్సిక్ స్టేజ్ అనేది స్టేజ్ 4 కిందకు వస్తుంది. ఇండక్షన్ స్టేజ్ స్టేజ్ 1 ఆఫ్ అనస్థీషియా కిందకి వస్తుంది. సో దేర్ ఆర్ డిఫరెంట్ స్టేజెస్ ఆఫ్ అనస్థీషియా. And even regarding pre-anesthetics, you can see my video in our channel Pharma Syndrome pre-anesthetic. I hope that is my first video. And in general anesthesia, stage 3 of plane 3 is. So stage 3 means the stage where the surgical procedure will carry. And again in stage 3, at which particular point the surgery will start. So that is the question here. So in stage 3 also again 4 different planes are there. 4 different planes are there. And what is the plane 3? So plane 3 is the dilation of pupil as well as a loss of light reflex. If you can observe in the movies also, if the patient in ICU room So the eyes will be like this, and on that eyes, the light will be focused. If when light is focused, if he blinks means he is still in the conscious nature. So it is not suitable for the carrying a surgery. But still he is like this, and if you focus light also, if he like this means okay, his all reflexes will be abolished, stopped for some time during the surgery. So then that is the indication of carrying into the surgery, and also dilation of pupil and no response to the any light reflex. And in rolling of eyeballs become fixed. This is the one of the option. And a paralysis of the intercostal muscle. This is the one of the option. And loss of corneal and laryngeal reflex. This is the one of the option. And the answer is dilation of pupils. That is loss of light reflex. So remember, the surgical procedure carried out in the stage 3 of the plane 3, the plane 3 where there is a dilation of pupils and loss of light reflex. So that's why the eyes will be like this, but no light reflex will be make no change because he's already entered into the conscious stage, sorry, unconscious stage. And which of the following drug produce malignant hyperthermia? So I hope you know malignant hyperthermia. Malignant hyperthermia, the condition in which a severe increase in body temperature due to continuous release of calcium from the rhinodine receptors of the skeletal muscle. So skeletal muscle contraction ఎక్కువ జరిగితే ఏమవుతుందంటే కనుక కాల్షియం ఎక్కువ రిలీజ్ అవడం వల్ల కాల్షియం ఎక్కువ రిలీజ్ అయితే బాడీ టెంపరేచర్ ఇంక్రీజ్ అవుతుంది. And this malignant hyperthermia is also one of the major drawback of succinylcholine, which is a peripherally acting skeletal muscle relaxant. That is succinylcholine. And in this category of general anesthetic, the halothane is causes malignant hyperthermia, and not a sevoflurane, and not a ether, and not a ketamine. Remember, ketamine is very, very important. It is also known as dissociative anesthetic. So remember ketamine as a DAC, DAK. K means ketamine, D means dissociative, A means anesthetic. And ketamine is a NMDA receptor antagonist. NMDA receptors are ion channel or inotropic receptor, also known as fast-acting receptors. So like this, if you come across 1 point ketamine, you have to recollect more than 5 to 6 points. Like ketamine is an NMDA receptor antagonist. Ketamine is a general anesthetic, and the ketamine blocks NMDA receptor. And the ketamine is a dissociative anesthetic. Ketamine can produce hallucinations. Like that, we have to recollect the number of things. And halothane produce a malignant hyperthermia, and the treatment for the malignant hyperthermia by the dantrolene, the drug which blocks rhinodine receptors on the skeletal muscle and blocks the release of calcium from the endoplasmic reticulum in the skeletal muscle, that is sarcoplasmic reticulum. And halothane also produces hepatotoxicity. Halothane also produces hepatotoxicity, especially because of its chlorometabolite. So trichloroacetate metabolite. And next is the question on the dexmedetomidine. So dexmedetomidine is also a general anesthetic. So regarding classification of general anesthetics, I also made an excellent video. You can remember easily with the tricks and mnemonics. Already that is in our channel Pharma Syndrome. Please watch that video and increase your knowledge on the pharmacology classification. And next is the dexmedetomidine is a drug acts on which are the following receptor. So it is not acts on NMDA and N-methyl deaspartate receptor, not acts on GABA, gamma aminobutyric acid, not acts on the glycine receptor. You know, both GABA and glycine are the inhibitory neurotransmitter in the central nervous system, and glycine is mainly present in the spinal cord. And both glycine, GABA, and sorry, GABA means gamma aminobutyric acid. Three types of GABA receptors are there: GABA A, GABA B, GABA C. In this, GABA B belongs to the G protein couple receptor. A and C are ion channel receptors. because they conduct chloride Cl minus into their channels. And here our question is dexmedetomidine is acts on alpha 2 adrenergic receptor. So alpha 2 adrenergic receptors belongs to the sympathetic nervous system called as adrenergic system, and the alpha 2 receptors present on the central nervous system. So the dexmedetomidine is a agonist on alpha 2 receptor in the CNS and producing the general anesthesia. And alpha 2 receptors are presynaptic receptors, also called as autoreceptor. The meaning is inhibit the release of their own neurotransmitter. And even there is a number of alpha 2 receptor agonists are there. For example, clonidine alpha methyl dopa for treatment of hypertension. And even some of the alpha 2 agonists like bromonidine like drugs also used in the treatment of used in the treatment of glaucoma. But in the competitive sector, if you are preparing for any competitive sector, your presence is very, very important. So what the thing you are listening, what the thing you are studying, what you are looking, and based on that you have to recollect the things from different corners, including different subjects also. And next question is, which of the following is isomer of ketamine having anesthetic action? So ketamine is very important drug. Ketamine having different isomers. In this, the S isomer of ketamine producing the anesthetic action. Producing the anesthetic action. So remember, the S isomer of ketamine is producing the general anesthetic action by blocking the NMDA receptor, a type of ion channel or inotropic receptor, also known as fast-acting receptor. So next we enter into the important MCQ having drug name propofol, and propofol is cause for death of the Michael Jackson because of he continuously used the anesthetics for relaxation purpose because of his stress different conditions. So because of continuous usage of these drugs like general anesthetic, the brain become dead and enter into the coma, and he enter into the death phase. And the stage 4 of anesthesia is a toxic phase where there is indication of high dose. Because of high dose into the central nervous system areas, the Michael Jackson become dead, and especially the supporting document saying that he took the propofol unnecessarily. So choose wrong statement about propofol. So propofol is a general anesthetic, that is we know, and it is available as a 1% emulsion having rapid onset of action because of its lipid solubility property and rapid action. That is also, and it causes emesis. Propofol does not causes emesis because it does not having any effect on the CTZ, chemoreceptor trigger zone. So generally, the drugs acting on CNS, generally they produce emesis, vomiting. Generally they produce emesis, vomiting. But the propofol does not produces vomiting. Next, question number 11. Which are the following drug useful for controlling bradycardia during the surgery? So generally, during the surgical procedure, all our body reflexes, all our body, the activities in the normal condition. So in that, there is a chance of the heart enter into the bradycardia. So chance of heartbeat, sorry, just a second. Okay. So here there is a chance of decreasing heartbeat. There is a chance of decreasing heartbeat may enter into the bradycardia. So we have to make that bradycardia not to the lower, and we should make towards the little bit 70 and 60 like beats. అంటే జనరల్గా ఏమవుతుందంటే కనుక సర్జరీ జరిగే టైంలో మన బాడీ యొక్క యాక్టివిటీస్ అన్ని కూడా నార్మల్ కండిషన్కి వెళ్ళిపోతాయి. ఆ టైంలో హార్ట్ యొక్క రేట్ అనేది మరీ లోగా వెళ్ళిపోయే ఛాన్స్ ఉంటుంది. సో దాన్ని మనం ఎలా కంట్రోల్ చేయాలి అని చూసుకుంటే కనుక, So that condition can be controlled by using atropine. Atropine. So not acetylcholine, not ethylene, not ether. Because atropine is a muscarinic receptor antagonist. So if you remember, agonism of M2 receptor, type 2 muscarinic receptors on heart by acetylcholine decrease the heart rate. But blocking of M2 receptors on heart by using atropine, blocking of M2 receptors increases heart rate because M2 receptors also autoreceptor. When acetylcholine agonist binds, there is a decreasing heart rate leads into bradycardia. But here the bradycardia may become severe and beats may enter into 40, 30 like that. So that's why we have to give atropine. That atropine blocks the M2 receptor and increase the heart rate because atropine is a opposite action of acetylcholine. Acetylcholine decreases heart rate, atropine increases heart rate by blocking M2 receptor. Okay, and then next question. Next question is number 12. Here, depression of cardiovascular respiratory center occur in which of the stage of anesthesia? So it is takes place in the stage 4 of anesthesia. Generally, the patient should not enter into the stage 4 of anesthesia because it is a dangerous stage which may lead to the coma and followed by the death. So why there is a chance of coma and death in the stage 4? Due to unknowingly, maybe unnecessarily, unintentionally increasing the dose of drug enter into the stage 4 where there is a damage of cardiovascular and respiratory centers present in the brain, in the CNS, especially medulla oblongata. If cardiovascular and respiratory centers are damaged, then no signal to the peripheral heart and lungs, and it leads to coma and death of the patient. That's why stage 4 is called as toxic phase or toxic stage of the general anesthesia. The indication of a patient entering into the stage 4 means the dose become higher. So that's why monitoring of dose is very, very essential during the surgical procedures, anesthesia procedure. And next, which of the following drug is an so the following drug is an inducing agent under general anesthetic. General anesthetic. Etomidate is called as inducing agents. Inducing agent. So generally, in the classification of general anesthetic, there are different inhalational gases, inducing agents. Inducing agents means generally they are taken by the form of injection. So here, etomidate is the drug as a inducing agent. So I already informed to you in this video only. So I already made a excellent video on the classification of general anesthetic with the tricks and mnemonics. Please watch that video to get a excellent knowledge on the classification of general anesthetic. So next question is number 14. List of below given. List of below given drugs all are general anesthetic. Among them, choose drugs block dopamine receptors. So, generally droperidol. Droperidol generally a potent antipsychotic drug, but it is also using as a general anesthetic. General anesthetic. And here it is the etomidate, thiopental, ketamine, all these are general anesthetic. But here, the following drug having general anesthetic property and it is comes under the blocking of dopamine receptor. Blocking of dopamine receptor by the antipsychotic. And droperidol is an antipsychotic. It can block the dopamine receptor and it can be used as a general anesthetic also. Next question number 15. Which of the following drug is not a inhalational category? Which of the following is not a inhalational general anesthetic? So regarding classification, gaseous general anesthetics are there, inhalational are there, inducing agents are there. And here it is a nitrous oxide is not a inhalational. Nitrous oxide is a gaseous general anesthetic. And ketamine is inducing agent, etomidate also inducing agent, dexmedetomidine is also a inducing agent. So nitrous oxide, ether, xenon are the gaseous general anesthetic. And nitrous oxide is a inhalational general anesthetic. And next, enter into the question number 16. Nephrotoxicity is caused by nephrotoxicity is caused by nephrotoxicity caused by the methoxyfluorine, not by the ether, not by the nitrous oxide, not by the isoflurane. So nephrotoxicity is a drawback of general anesthetic methoxyfluorine. Next, wait. Production of cortisol can be reduced by production of cortisol can be reduced by. So generally, one of the drawback is there, that is cortisol production may decrease. Cortisol production may decrease because of using one of the general anesthetic. But here, production of cortisol can be reduced by the answer is etomidate, especially the etomidate. Why it is decreasing cortisol production? Etomidate inhibiting the conversion of cortisol active form. So it is not converting the inactive form of cortisol to the active form of cortisol. That's why there is a decreasing production of cortisol or corticosteroids production if etomidate dose is higher, but not a midazolam, which is a benzodiazepine, but not a sufentanil, which is a opioid category drug, and but not a methoxyflurane, but not a methoxyflurane. So remember, using of etomidate or high dose of etomidate decrease the cortisol production, prevent the conversion of inactive form of cortisol to active form of cortisol. And even especially antifungal drugs also affect the steroids production by inhibiting the enzymes in liver, like ketoconazole. Antifungal ketoconazole inhibit the steroid production by inhibiting the enzymes in the liver, because in the liver there is a synthesis of steroids and also production of cholesterol also. And next question is last question in this MCQ part. Production of cortisol can be reduced by. So unknowingly the question is repeated. So the production of cortisol can be reduced by the etomidate. So etomidate drawback is it decreases production of cortisol in the body. So this is simply about MCQs regarding the general anesthetics. I hope you got the knowledge. So please go through the this MCQs and also watch the classification of general anesthetics in our channel. Thank you.